Welcome to this tutorial on radiological images, detailed notes for radiographers. In this video, we'll explore how X-ray images are formed, the factors that affect their quality, and the crucial role radiographers play in ensuring diagnostic accuracy. Slide 2, Definition. A radiological image is a visual representation of internal body structures produced by X-rays or other forms of radiation. It works on the principle of differential absorption, meaning different tissues absorb X-rays differently. Dense tissues like bone appear white, while air-filled regions like lungs appear dark. Slide 3, Principle of image formation. The brightness and shades in a radiological image depend on how much radiation each tissue absorbs. Bones block more X-rays, making them radiopaque, while air and soft tissues allow more X-rays to pass, appearing radiolucent. This variation creates the contrast we see in diagnostic images. Slide 4, Steps in image formation. The process begins with X-ray production in the tube. The X-rays then pass through the patient, where some are absorbed and others transmitted. The transmitted rays are captured by the image receptor. And finally, the image is processed, either digitally or on film, to create the visible radiograph. There are several types of radiological imaging systems: conventional film screen radiography, computed radiography, and digital radiography. Other modalities include fluoroscopy for real-time imaging, CT for cross-sectional views, and mammography for breast tissue analysis. Image quality depends on several parameters: density or brightness, which is controlled by MAS, contrast, influenced by KVP, sharpness, which depends on focal spot and motion, and magnification and distortion, determined by distance and positioning. Finally, noise affects the clarity of digital images. Image quality is influenced by both physical and technical factors. Physical factors include tissue thickness, atomic number, and scatter radiation. Technical factors include exposure settings like KVP, MAS, SID, and OID, all of which must be optimized for each patient. Artifacts are unwanted marks or patterns that can mislead diagnosis. They may result from patient motion, grid misalignment, and mismatch. Double exposures or detector issues in digital systems. Identifying and eliminating artifacts is key to maintaining high-quality diagnostic images. Slide 9, Image Evaluation Criteria. Every radiographer must evaluate an image before approval. Check for proper positioning, adequate exposure, sharpness, correct collimation, and presence of patient identification markers. A good radiograph is free from artifacts and shows all required anatomy clearly. Slide 10, Radiographer's Role. The radiographer's role is vital, from selecting correct exposure factors and positioning the patient to ensuring safety and quality. Radiographers combine both technical and clinical expertise to produce diagnostic quality images while minimizing radiation exposure. Slide 11, Image Storage and Retrieval, PACS. In modern hospitals, radiological images are stored digitally using PACS, the Picture Archiving and Communication System. It allows for easy storage, retrieval, and sharing of images, improving workflow and accessibility for radiologists. Slide 12, Common Errors and Corrections. Common imaging errors include underexposure, overexposure, motion blur, and geometric distortion. Proper exposure settings, patient stabilization, and alignment corrections help produce accurate and repeatable results. Slide 13, Radiation Protection. Safety is always a top priority. Apply the ALARA principle, as low as reasonably achievable. Use lead aprons, thyroid shields, and gonadal protection. Always limit the beam to the area of interest and maintain proper distance and shielding. Slide 14, Summary. To summarize, Radiological imaging is the foundation of diagnostic radiology. Image quality depends on exposure factors, patient positioning, and radiographer skill. The ultimate goal is to achieve diagnostic accuracy while ensuring patient and operator safety. For further reading, refer to textbooks like Carlton and Adler's Principles of Radiographic Imaging, Bushong's Radiologic Science for Technologists, and Bontrager's Textbook of Radiographic Positioning. These resources are essential for every aspiring radiographer. Thank you for watching this tutorial on radiological images for radiographers. If you found this helpful, don't forget to like, share, and subscribe for more radiology and medical imaging lessons. Stay safe and always remember, radiation protection first.